And I think that prescribed product pathway is really interesting. We had some data yesterday, Chandana, looking at an Australian sentiment survey and showing what countries, the Australian digital health companies are looking out to, and they were broad, they weren't all digital therapeutics. But there was some discussion at the end of that the EU wasn't as high as, say, the US and some other markets were on the list. And so, but then, today I think it's been really interesting data around the opportunities for reimbursement for digital health technologies. So I was wondering if you could give a little shout out to the European market for those in the audience who maybe should be considering it if they're going to be able to get onto these regulated lists.
Yeah, so while the pathways exist and there's a beeline, and it's really great that Germany, Belgium, the UK are all getting on this. However, that said, so we have 24 approved, like I said, over the last year or so since the DIGA has come out in Germany, but there's been thousands of applicants, right? So it's not that easy. So just because the path exists, it doesn't mean everybody's able to get in. But that said, once you're in, the average price of reimbursement for a lot of the products is around 400 euros, which is really quite significant when you think about it. And you have to go through, the medical device validation or approval as well. So I definitely think it's worth pursuing. And, once you get in, then you're in. And it's because of that, you're not trying to lobby to multiple different parties or multiple different insurers. However, even within Germany, you have a significant private insurance market. So you could choose that path as well. So I wouldn't say that it's not a ripe economy. In fact, I would say a lot of the Americans that I speak to or the companies in other parts of the world, they look to Europe as a model to emulate.